lecture. I'd like shortly to let you look at this syllabus to give you an impression what shall we speak about during these following months. Okay? So now I will share with you the syllabus. I hope you see it, right? So during these 3 months, we have to cover first 3 chapters. This is philosophy of science, ethics and scientific conduct, and also ethics in human and animal studies. The book, which is also uploaded on your drive, is Research Methodology, and the author is Peter Lake. This is a very nice textbook. It's quite short for this subject, and it covers all main topics which are needed for us to understand the very basics of research. The very basics of research. First of all, let's have a look on the title. The book is titled Research Methodology in the Medical and Biological Sciences. So we have to understand why do we have this division? Why we separate the research of biomedical sciences and medical research from other sorts of researches. If you do not have book on the drive, that's not a problem. We shall ask our coordinator to upload it. Okay? So don't think about it. It will be uploaded soon. Maybe it's not uploaded, but it will be uploaded today. So why do we divide research for different sciences? As you know, we have different branches of sciences, right? To divide them in 2 huge groups, we have biomedical sciences and social sciences. Okay? So research is different for biomedical sciences and different for social sciences. From the 20th century, the research is multidisciplinary. What does it mean, multidisciplinary research? Multidisciplinary research means that different sciences use different methodologies. For example, biomedical sciences may use methodologies which belong to humanities. And humanities may use methodologies for research which belong to biomedical science. So the main idea is that in order to reconstruct the world around us by research, we need to conduct multidisciplinary research. It's clear, right? So multidisciplinary research means that we are not limiting ourselves with research possibilities of a single science. Multidisciplinary research means that we are reconstructing the universe around us using all possibilities that we can imagine, that we can create, that we can use in order to understand better how our organism is composed, how things around us work, and how can we understand the very basics of our physiology and our anatomy. So I would ask you to turn off your microphones, please, because there is some additional voices. Okay? Thank you. So why do we need in our biomedical sciences this subject? You may ask, maybe this is some additional subject and it is less needed because research is not anatomy, research is not histology, research is not pharmacology, and why do we need it? First of all, we have to understand that all knowledge which we are introducing at universities, at medical schools, is accumulated by research. Without research, there is no knowledge. Without research, we have nothing to teach to our students, to our doctors, to our physicians, to our young specialists. So research is absolutely needed for the single reason. If we want to understand something new or to improve our understanding, we have to accumulate new knowledge. So all universities around the world, they are divided into two groups. These are teaching universities and research universities. You can imagine what does it mean, right? Teaching university means that we are putting more than 60% in teaching and some 40% in research. Meanwhile, research university means that we are doing 60% research and 40% teaching. But never mind which is the percentage. The main idea is that these two poles, teaching and research, they are inseparable. You cannot say that for happy life we need only teaching or we need only research. So both components are very important and both components are working together. So we are teaching and we are researching. By researching, we are accumulating new knowledge which we are sharing by teaching, and the teaching is providing new questions for research, because during teaching, during introducing new knowledge, new questions appear. We want to know more. We want to be more precise, more detailed. Okay? So that's why we need to understand, why do we need this research? Research is a fascinating story of discoveries and of improvements. So what is the difference between these two definitions? What is discovery? Discovery is when we find out something new which was unknown earlier, right? For example, discovery of X-rays. It was a revolutionary discovery for medicine because we use X-rays as a diagnostical tool. It's very important to diagnose different pathologies. It's very effective, not in all cases. Not in all cases, not for all systems, but in a lot of cases, it's very important. And we are basing our treatment options on X-ray results, right? And what is improvement? Improvement is when we have already discovered something, or chronologically before us, some other colleagues have discovered something, and we are improving their discovery. Why improvement is also important? Because improvement means more qualified knowledge. Improvement means that we are armed with more detailed knowledge. Okay? So improvement is also very important. And what is main idea of research and science? The main idea of research and science is to benefit all members of society. So if we don't put the research data into practice, there is no need for this research, because we are medical doctors. We have responsibility for our population, for our society members, and we have to bring the research data into hospitals, into clinical departments, to improve the public health, the health of the public. So the main idea of research is to benefit the society. And if research benefits only researcher, we do not call this science. Okay? Because the main idea of science is to improve the life of citizens. Because research is a civic phenomenon. We have equally to distribute our research data. And during our next lectures, we shall speak about two very important phenomena. One is called scientific conduct, and another is called scientific misconduct. So what is the difference here? Scientific conduct are the rules how to conduct research, how to conduct surveys, how to plan ethically the experiments, clinical trials. And what is scientific misconduct? Scientific misconduct is when we violate these rules, when we do not follow them, and when we do not benefit the lives of our citizens. For example, if you will read a little bit history, you will find out that in 20th century, during some period, Germany was ruled by Hitler's government. And they had very strong and very equipped laboratories for that time, of course. And they were providing and conducting experiments, even trials on people. But we do not call this science, because the idea was not to benefit the society, but to synthesize poisons, to use them during wars, during invasions, during armed conflict. So you see, they were investigating something, they were experimenting on people, and we cannot call this science. Because humans cannot serve as experimental animals. When we are observing humans, we call these clinical trials. Please remember, we don't use the definition experiment when we speak about human. There are experimental animals, for example, white rat, white mice, frogs, cats, dogs, pigs, and another sort of animals. But even working with animals, we have to follow some ethical rules to limit ourselves with some ethical restrictions. For example, we cannot let animals to feel pain during the experiment. Or if animals die during or after the experiment, they have to die without suffering, without feeling pain. So chapter 2 covers all these issues related with ethical questions. So you should take into consideration how to plan your research. We shall speak about these questions in a more detailed manner during next lectures. Okay? And if you will have any questions, you can write me in chat or in email, and I will try to answer. So, what is this about this first introductory lecture? First of all, I want you to understand the structure of the discipline. Okay? Our research methodology is divided into two parts, as I have already mentioned. This is part 1, which covers chapters 1 and 6, from 1 till 6. The 6th chapter is included. And this is part 2, which covers from the chapter 7. Okay, during this semester, we shall speak about part 1. And from September or October, we shall continue with part 2. How we are organizing our study process? We shall have two midterm examinations, which will be composed of 30 questions, each of them. And there are two sorts of questions. There will be multiple choice questions and MCQ, and true and false questions. Okay? So MCQ and true or false questions. And for final, we shall have 40 questions of the same structure, MCQ and true or false questions. So, on the first lecture, we have to understand the basics of research. As I have already mentioned, we have two groups of sciences, empirically speaking. For example, we have biomedical sciences and social sciences. We have to understand why do they need a little bit different research methodology, right? Why cannot we use the same methods? We cannot use everything the same for a simple reason. The idea is that biomedical sciences are based on knowledge. Meanwhile, social sciences are based on interpretation. So, what is the difference, to speak in a little bit more detailed manner? Interpretation means that we are interpreting some question based on our subjective understanding of the topic. Okay? Our understanding is not or is less evidence-based. What does it mean, evidence-based? You understand what is evidence and you know what is based, right? So evidence-based means that our conclusions are based on concrete empirical evidence, for example, statistical data and its analysis, right? In humanities, we do not possess this possibility or possess it in a lesser manner, in a lesser way, compared to the biomedical sciences. In biomedical sciences, we base our understanding on pure knowledge, only on knowledge, not on interpretation, right? We have, for example, statistical data, and we are formulating our conclusions based on the statistical data. We cannot say that, I suppose, according to my point of view, as far as I understand, we cannot use these expressions. The main idea is we are explaining, not interpreting. We are understanding. This is the main idea in case of biomedical sciences. We are understanding how our organism is composed, which are concrete functions of tissues, because the structure of tissue determines its function, or we can say that function is determined by structure. So function and structure are very closely interrelated and interconnected, right? So why do we have to use microscopical studies? To see, to visualize the structure of tissue, the composition of cells, because their function is based on this, right? So during biomedical research and medical research, we are understanding. Meanwhile, during social research, during philosophy, during humanities, we are explaining. For example, Latin American thought, philosophical thought in the 20th century Latin America. How we are studying this? We are reading books of Latin American philosophers, writers, poets, and then we try to interpret it. Or we are observing some cultural characteristics of population which live in Latin America, and we are trying to explain it. So it's not understanding of the phenomena, it's an explanation of the phenomena. I hope it's clear, right? In biomedical sciences, we need to understand how concrete cells, tissues, organs, systems, pharmacological agents, vaccination, how do they work? Our only purpose is to understand, not to explain, right? For these purposes, we are providing different sort of experiments. One of them is in vitro studies. What is in vitro studies? In vitro studies is when we are studying, for example, cells in isolation, in an isolated ambience. Another sort of study is in vivo studies. What are in vivo studies? In vivo studies is the studying of functions and observations. For example, we are studying liver tissue during experimental model. We are creating some experimental model and we see how liver tissue is functioning. We also have studies such as experiments, as I have already mentioned, and clinical trials. So the difference is already known for you. Clinical trials is when we are observing people, for example, patients at our clinical departments. We are introducing some new medication during clinical trial, and we are observing the effects of these medications. How effective is the administration of this medication? We are registering side effects of medication. And after, we are starting thinking about how to improve, how to diminish, and how to totally eliminate the side effects of this concrete medication. So this work is called clinical trial. Okay? Another one is experimental model. Why do we need experimental models? We are artificially creating new reality. For example, let me say bilateral hepatectomy. What is bilateral hepatectomy? Bilateral hepatectomy, in a few words, is when we are cutting liver tissue in order to observe the regenerational possibilities of liver. How liver tissue can regenerate in concrete, abnormal situations when we are cutting it, right? So from literature we know that liver tissue compared to other tissues has a little bit higher possibility for regeneration. It means that when we lose some liver tissue, when it's lost, liver cells start the replication process, the proliferation, and the rate of proliferation is high, and we receive, in a concrete period of time, we receive new and new hepatocytes in order to compensate the tissue which we have cut during our experimental model. So the idea is that we are creating abnormal pathological picture, and then we are studying the possibilities of liver tissue, how it reacts, right? Why do we need, think a little bit, why do we need to study proliferation, the rate of proliferation, the possibilities of proliferation, the division of cells? It's very important because a lot of pathologies, for example, cancers. What are cancers? Cancers are uncontrolled growth of tissues, of cells, uncontrolled proliferation. What does it mean, uncontrolled? It means that organisms cannot control the appearance of new cells. Okay? So the problem here is that we need some quantity of new cells, but we receive more. That's why this process of proliferation is called uncontrolled proliferation. So uncontrolled proliferation is revealed as cancers in some cases, right? Why do we need to know the genetical mechanisms of proliferation? We need to know the genetical mechanism in order to start manipulating to start stimulating or to start inhibiting the control, the proliferation when it's not needed anymore. So molecular biology is a very important branch of biomedical research sciences, which gives us new possibilities to understand the genetical mechanisms of diseases and to have possibilities of positive outcome during treatment, to have possibilities to stimulate the replication of some genes or possibilities to inhibit the activity of other groups of genes which are responsible for concrete disease, right? So there is new terminology. You will have to read a little bit more because you are medical students and you have a lot of additional disciplines which enter in your profession. You cannot isolate yourself only with medical subjects, right? Because you need a lot of feedback from social sciences also, for example, from psychology, from history, and of course from philosophy, because our patients are not composed only by organs, by tissues, and by cells. They are also spiritual beings, right? We have our cultural preferences, we have our religions, we have our understanding of the world around us. So when we have new patient, we have to understand his or her understanding of the surrounding world and of cultural peculiarities. And that's why we say that we are not limiting ourselves only with biomedical sciences. We are trying to understand the main peculiarities of each patient, and that's why 21st century medicine is patient-oriented medicine. What does it mean, patient-oriented medicine? Patient-oriented medicine means that we have medicine, very individual sort of medicine for concrete patient. Okay? You know, for example, we are studying psychiatry, but psychiatry is not possible to separate from psychology. And one of the additional methods of treatment of patients is psychotherapy. What is psychotherapy? You probably know psychotherapy is stimulating the internal forces of a patient without any medications. For example, psychotherapy is when you are depressive, when you are experiencing some problems related to your career, to your sad love story, to your family problems, okay? And you go to doctor psychotherapist, and doctor tries to find strength inside you by speaking on the topic, by analyzing questions which you may be afraid to analyze when you are alone, but they come easier in conversation, okay? So the main idea of these approaches is stimulation of internal possibilities of patients. That's why we say that medicine is patient-oriented discipline, patient-oriented science, patient-oriented phenomena, okay? So in our subject, in research methodology, we have to understand some concrete topics, one of which is research is absolutely needed for accumulation new data and bringing the research data into hospitals to improve the treatment, to improve the outcome, to reduce the side effects, and to avoid the complications. Okay? So, the main idea of our research is to understand how to plan it, how to plan the research. We should have research protocol. Okay? What is research protocol? You can use either research protocol or research plan. In different textbooks, you will find different definitions. So research protocol is step-by-step, very short description, what you are doing during your research. Okay? The step-by-step plan is called the research protocol. Research protocol means that you have very clearly and shortly, I repeat, it should be very clear formulation and very short formulation of your research idea. What is a research idea? Research idea is an idea which I was to investigate. Something that interests me. For example, I want to find out some new information about beta blockers. Some new generation of beta blockers and how to administer them during the second part of the pregnancy. How to diminish the side effects, how to avoid, for example, some complications like insomnia or headache or bleeding, etc. So the main idea is that in my research protocol, it should be very clearly and shortly. Why shortly? Not to be confused. Okay? Very clearly and shortly stated my research idea, my scientific idea. Next step is research hypothesis. What is research hypothesis? Research hypothesis is, I suppose that this group of medication should act in this manner, and let me check. And to check, I need to do this research. Okay? One very important part in your research methodology is occupied by description of the methods. So what is methodology? Methodology is the science about different methods which we use, right? But we should understand the concrete methods, because in different research protocols, there may be different methods used. Even if we are conducting very similar studies, very similar research, we usually use different methods, or our methods may be modified, right? For example, we know the staining, you will read about it in your textbook of histology. For example, hematoxylin eosin staining, right? Or silver impregnation, if we want to stain chromatin, or different methods of staining. But it may happen that for concrete purposes, you are staining using the basic method, but with modification. Okay? So when you will publish your research, which may be report, which may be scientific article, which may be case study, when you will publish it, you have to indicate that you used this concrete methodology and its modification. You know, as we have mentioned communication, let me explain here a little bit deeper. You will read about this in your textbook, but you know, lectures are, I call them introductions into textbooks, right? Because textbooks are always very perfect, are always very detailed, because in biomedical sciences, mostly, textbooks are composed not by single author, but by group of authors, which are called co-authors, right? Why? Because the knowledge in biomedical sciences is very divided. Because we have an ocean of knowledge and we have to sort it somehow, right? So the textbooks for medical students are composed by a group of people. For example, two of them write chapter 1, two of them write, another two write chapter 2, and we have some 6 or 7 authors of the textbook. But what are lectures in my understanding? Lectures are introductions into textbook. Okay, that's why I would ask you to be presented, to listen to me in order to find where to make emphasis, what to highlight. Okay, so the main topic here is that science and research and its results, new data, needs to be communicated. You understand what does it mean, right? Communication. Communication is a very wide definition. Now imagine, we are speaking with you, it's communication. You are speaking with your peers, with your friends, with your colleagues, is communication. I speak with university administration, it's another type of communication. And we have one more sort of communication, which is called scientific communication. What is scientific communication? When you have new definition, I would advise you always to look deeper in the words, and you will find out what does it mean, this new definition. Scientific communication means communicating the scientific data. Okay, the new data which we have accumulated as a result of our research. Okay, so scientific communication may be divided into two large groups: inter-oral communication and inter-written communication. Now you can easily imagine what is oral scientific communication, right? Oral scientific communication is conferences, participation in conferences, congresses, round tables, some scientific visits. And what is written communication? Written communication is when we are reporting in a written form the result of our research. For example, scientific articles, review articles, overview articles, and case studies. We shall speak about them in a detailed manner later. But now what I want to underline is that scientific communication needs possession of scientific skills of expression. What does it mean, scientific skills of expression? You can write, for example, an article, and it may be philosophical article. You can write a narrative, and it may be literary narrative or historical narrative. And at the same time, someone can write scientific article. The difference is that the composition of scientific article is based on scientific style of expression. Okay, we have the concrete structure which we are following, the concrete structure of article, for example, right? How do we use these skills, and why it is absolutely necessary to follow them? The main idea is that our research is, as I have already mentioned, evidence-based research. So evidence-based research means that we base our conclusions on evidences which are received during our research. That's why we have to structure two main things. We have to structure our research protocol, and we have to structure our written scientific communication, or our article, okay, our report. The structure is very important here, because without structuring, without this concrete understanding of the steps which should be realized, we may easily be confused. Okay? For example, when we are creating the groups of experimental animals, we have created 3 groups. For example, group number 1, group number 2, group number 3. And never mind how many groups we have, we need to have the one group which we shall call the control group. What is control group? Control group is the group which gives us possibility to compare the results which we receive in the experimental groups. For example, if we are performing bilateral hepatectomy and we are cutting liver tissue in first group animals, second group animals, and third group animals, and after we are injecting some medication to see how this medication stimulates the proliferation of liver tissue, what are we doing in a control group? We are cutting the liver tissue in the same manner as we have done in experimental groups, but we do not inject here the medication. So we are reproducing the experimental reality in the control group, and then we are comparing the results in order to see how this medication injected in experimental group works here. So if we do not have control group, we have nothing to compare our data with. Okay? If we don't have to compare, we cannot analyze. So based on our results, which are analyzed, we are forming conclusions. So please remember this. Conclusions are the products of results which are received by analysis. And by generalization of conclusions, we receive recommendations. Generalization of conclusion gives us recommendations. Why do we need to generalize and why do we need to recommend? Because we need a big quantity of animals, a big quantity of humans in order to receive some evidence-based data, right? And no survey, no experiment can support a big amount of materials for investigation. So we take some quantity, which is absolutely normal for statistical elaboration, and only after this we are generalizing the statistical data in order to give recommendations. So we are generalizing our data on a larger population, right? So this is the main idea of why our research protocol should be step-by-step stated, and the same in case of our article, or you may call it report of your investigation or report of your survey, right? If you don't want to be confused during or after the experiment, you have to follow these steps very accurately. You need almost 100% accuracy in order not to be lost, in order not to formulate erroneous conclusions. Because if you will formulate erroneous conclusions, you will formulate erroneous recommendations. You will generalize the erroneous data and you will formulate the erroneous recommendations. And we don't have this luxury because we cannot perform the same experiment billions of times, right? Because a lot of money is needed for planning, for conducting, for analyzing, and for publishing. In a few words, for communication of your results, right? So one of the forms of scientific communication, as we have already mentioned, is written communication. So I want to pay your attention now in forms of written communication. There are three main forms of scientific articles. Today we shall speak about this in a little bit detailed manner, okay? So which are these articles which we can publish as a report of our research? So first sort of article is review or overview article. So what is the difference? Why I say overview / review? Why two definitions, right? Let us start with overview article. What is overview article? For example, you have some scientific idea and you want to formulate it into research hypothesis and to write research protocol, okay? You know, in medicine and in biomedical sciences, a lot of things are already investigated. So before you start your research, you have to find out what other researchers have done before you, chronologically earlier, right? For example, you are studying some treatment of epilepsy, and you want to find out some new medications, how to treat epilepsy in a better manner. You have to understand what was done before you, how to find this. This is called, please remember these definitions, okay? This is called library research. So what is library research? Library research is sort of research which is conducted at libraries. So you go to library and you read different sources, which may be scientific articles, books, monographs, proceedings of conferences or scientific meetings, and scientific databases. What are scientific databases? Scientific databases are online platforms which gather information from different journals, books, monographs, proceedings, and they collect it. Scientific databases are multidisciplinary or single disciplinary. Multidisciplinary are databases which collect information, medicine, medical information, humanities, engineering. Single disciplinary are, for example, only medical databases, for example, PubMed, Medline, they are only medical databases. So you go to library and you start searching, looking for information on the concrete topic. Once you have collected this information, you are writing the overview. So what is overview? Overview is the compilation, the synthesis, the collection of different information which is disseminated in different sources. You are collecting them into one single paper. Okay? So the extension, the length of this paper may differ. There are no rules. In my practice, I have read papers, overview papers, which had the extension of 80 pages, and another one with a couple of pages. So every case is very individual, and I cannot give you rules that, for example, overview article should be composed of 45 pages. No, it's up to research needs, up to information collected, up to fantasy of researcher, of individual who writes, of person who writes this overview article. So please remember that nobody can tell you you should need to write overview article of 25 pages or 15 pages. It's up to you. Once you consider that based on the sources you have made it full, it's enough, and you have done with this. Okay, this is overview, just putting other people's data together. It's like puzzle. You are creating a picture. But what is a review? Why do we differ one from another? So review is the same that overview, but the difference is that at the end of the review, you are indicating where is the weak point here, for example, in treatment of epilepsy. What is the challenge? Where is the weak point here? Where is the gap? And how to bridge it. Okay? So review is a little bit original composition because you put something yours inside there. Meanwhile, overview is just listing of facts, of medical facts, of research facts. And review is something yours, some suggestion, some recommendation, something that nobody before you has formulated in such a manner. This is review. So please remember the difference, because students are frequently confused. They think that why do we need these two names? Because the overview, review is the same. No, it's not. It's not. Okay, it's one sort of written communication, which is called overview or review article. Another sort is original article. What does it mean, original article? Original article means that everything what is exposed in it is your original production, that nobody before you has written it in such a manner, and it's fully based on your original research. Okay? So original article is an article, or in some books you may find as scientific article or original article, never mind. So original article is your original creation, is the report of your experiment, of your clinical trial, of your observation. It's yours. Okay? And nobody can use it without making reference to your name, without citing you. Because if I will write something, and if I will use data from your original article, and if I do not make reference to your article, if I do not name you, if I'm not citing you, it's called plagiarism. Plagiarism. It means I'm a thief. I took someone's ideas without paying attention that these ideas are not originally mine. Okay? So when I do not indicate that these ideas are yours, it means they are original and they are mine. And in case if they are not original, I have to indicate that based on the research provided by Black and White or Phillips and Morgan, so what am I doing? I'm making reference. I'm citing them, right? I respect their work. their scientific ideas, because my work is based on their ideas and I have to respect this. In other cases, this is called plagiarism, and these are criminal cases. And in different countries, there are different measures to fight against plagiarism. For example, if after defending your PhD, the scientific committee will find out that you have used other people's data without making reference on their work, your PhD degree will be annullated. So it's very serious, and we shall speak about this when we will start discussing the topic of scientific misconduct, because plagiarism is one of the types of scientific misconduct. When I am conducting myself not ethically, not in a very scientific manner. So this is original article. You understand now what it means. Original article means that you have created something new. Either you have new discovery, you have discovered something, or you have improved something. You helped the science to accumulate new data. This is original article. So we had review or overview, original article, and the sort of written scientific communication is case study. Case study. What does it mean, case study? Let us analyze the title. Case study means when we are studying the cases. Perfect. Let's go deeper. What does it mean studying cases? Imagine that you are a physician, acting physician, and you have patient with pneumonia. But your patient's pneumonia's clinical manifestation is a little bit different from clinical signs which are described in special literature, in textbooks of internal medicine or something like this. For example, if you need to have high fever during 7 days, you have 2 days high fever, and the fever is not high, or something like this. So when the clinical picture is different from classical understanding of the disease, these are called exceptional cases, right? Which do not support the main picture. What are we doing in this case? We are describing this patient in a very detailed manner. We start with the beginning, with the first signs, okay, with family history, with first signs, with diagnostical tools which we have used to diagnose the disease, with treatment, with complications, with side effects of complications, with outcome, what was the disease outcome, with follow-ups, because this case is very important because it's exceptional. So, and we are describing this case, and we are publishing this case as a case study article. These type of articles are called case studies. Why do we have to publish them? This is due to our profession. We are helping medicine to develop. We are grateful to our profession. We are describing rare cases. And we also help to our colleagues, which live in different countries, on different continents, to be armed with new knowledge. Now, I will bring you one example. All around the world, there are described 17 cases of ectopic liver. What is ectopic liver? Topos means place. Ectopic means that something is not located in its proper place. So ectopic liver means that liver is not located where it should be located anatomically. For example, supradiaphragmatic position of liver, it's ectopic liver. So it means we have two places where liver tissues are located. Normal hepatocytes without any alteration of normal functions of liver. And how these cases were registered? They were accidentally diagnosed because in one case, doctor thought it was abdominal tumor and they made computed tomography. Another case, they thought about tuberculosis or some another type of malformation. And they discovered intact liver tissue in different regions of our body. So the problem is to let other colleagues know about this, to publish the case reports, articles, and if I will meet the patient with abnormal position of liver tissue, as I'm already armed with this knowledge, I can easily understand that this is case number 18. This is a new case of the same phenomena. The question that there were only 17 cases described does not mean that there were not other cases. Other cases simply were not described. They were either missed, other cases of this ectopic liver, or because this liver tissue was normally functioning, they had no reasons to search for pathological findings or data. Now you see how important it is to publish the case report, because you are accumulating new knowledge, new data, and not only accumulating, but you are also sharing it with your colleagues. One case of this ectopic liver is from Japan, another from UK, another from Germany. Now imagine how important it is that I'm sitting here in Georgia, in Tbilisi, and sharing with you information that the phenomena of ectopic liver exists. And how can I share this? Because someone in Japan was not lazy and described this. He or she describes this for you to give you more information about this pathologic condition, about this abnormality. Okay? So as we see, to summarize, there are three main forms of written scientific communication which we can use. First is overview or review lecture, review article. Another is original article, which is based on our original research. And the third is case study. When we are publishing, when we are reporting something that is very rare, something that is our case. We use this definition case study in a singular form, but please don't be confused. We may publish single patient case, or we may publish 15 patients. We are just grouping them. Okay? If I see that I have ectopic liver of 5 patients during 2 years, I can group this data and publish as a single case study. So the article will be called case study in singular form, but I can publish on more than one patient. Remember this, okay? Case study does not mean publishing only about single patient. Or you may publish different articles. If you have one case in a year, you can find 3 or 4 cases during 5 years. Okay? So please remember that case study is when you give due to your profession, because you are grateful to medicine, because it's It helps you to survive, it helps you to live, and it helps you to help other people. It's your social and civic responsibility to publish case studies. Why I am underlining this? Because medical doctors, which work at hospitals and clinical departments, they frequently are very busy. They work 10 hours, 12 hours. They are very tired. And after this hospital life, they want to rest. They want to forget a little bit about. But it's their responsibility to publish what they can publish and to communicate their colleagues about new data which they have accumulated. Okay, these are three main types of written scientific communication. In the first chapter of our textbook, which some students communicate that it's already updated, the textbook, I hope you will easily find the syllabus also. In the first chapter, we have to read about philosophy of natural sciences and philosophy of social sciences. As I have already mentioned, there is a difference, and you already know this before, between social sciences and biomedical sciences. And please remember that this word philosophy, it's like word communication. Philosophy is a very wide definition. Philosophy may be understood as a subject, philosophy. Philosophy may be understood as my understanding of life or my life philosophy. What I consider good and what I consider evil. It's my life philosophy. Philosophy may be philosophy of my communication with students, with colleagues, with university administration. So what I want to say, in case of sciences, we differently use this word philosophy. In our case, in case of sciences, philosophy of biomedical sciences means nature of biomedical sciences. And philosophy of social sciences means nature of social sciences. Why do we need to understand the nature of sciences? In order to understand the essence of sciences, how the sciences are composed, and which methodologies they use in order to accumulate new data, to receive new scientific data, and please remember, immediately to share. Immediately to share. Because when you will make, for example, your library research, you will find out that all articles you use for your research use articles which are published as a maximum 5 years ago, not earlier. Why do not we have luxury in biomedical sciences to use articles which are published 20 years ago? We cannot do it because in biomedical sciences, the information is accumulated very rapidly. This is a very accelerated form of receiving new data. And we don't have the luxury to use the data for treatment, which was accumulated, imagine some 20 years ago. Even articles published 5 years ago are not updated articles. We need to use for our bibliography only articles which are published as a maximum 3 years ago, 5 years ago, not earlier. So the second chapter is about ethics and scientific conduct. We have a little bit mentioned about this. As we know, we have, and we shall speak about this next Saturday in a more detailed manner. We have scientific conduct and we have scientific misconduct. So research and conduct, they all have rules and we have to strictly follow them, right? So scientific conduct means rules according to which we have to plan our research protocol and realize our research. Scientific misconduct is describing the cases how not to act. One of them I have already mentioned. This is plagiarism. When you use my research data without making reference on it, without naming me, without citing me. Okay? This is one of the sorts of scientific misconduct. And what about ethics? Ethics means that we are acting ethically, speaking about experimental animals, acting and planning clinical trials, and with our colleagues also. Plagiarism may also be considered as unethical way of acting with colleagues, right? So we shall speak next Saturday about misconduct and how it occurs, about authorship issues. What does it mean, authorship? When we are publishing something, who is the author of this written scientific communication? Because in biomedical sciences, we have multiple authorships because we need technical staff to work with experimental animals. We need technical staff to work with laboratory equipment. We need people who are analyzing research data. We need people who are conducting experiments manually. So it's normal that we have scientific article and we have several authors here. Some 3, 4, 5 authors, right? So authorship issues are very important. And the violation of authorship issues may also be reasons for scientific misconduct, or something that we can later estimate as scientific misconduct. We shall also speak about fabrication and other forms of misconduct, about how to disseminate correctly the received research data. Because one thing is the accumulation of data. Another thing is analysis of data and its generalization. And as we already know, we have to disseminate it, to share it, and how to share it correctly. This is also that forms part of philosophy of biomedical sciences. So I will be very glad if you can start reading first 3 chapters, chapter 1, chapter 2, and chapter 3, which will compose our first midterm. Okay? Just start with philosophy of science and try to find differences between philosophy of biomedical sciences and philosophy of social sciences. In case of any difficulties, in case of any misunderstandings, or maybe you will be a little bit confused because it's a new subject for you, please do not hesitate to contact me, to send me email, or to write in chat, and I will try to find answers with you. Okay, so this book is quite a short one. At the same time, it's quite a detailed one. If you will find out that some chapter interests you more, I can provide you with additional textbooks, right? We have a very nice library with ebooks, and I can ask school coordinator to send you some additional materials. I can provide some scientific articles which describe the issues of scientific conduct or misconduct or plagiarism or ethics. So just first of all, try to read the contents of the book, to orient yourself in the content, and then to highlight what you are interested in, right? So this was an introduction, first lecture. As I have already mentioned, lecture is an introduction for textbook, okay? But textbooks are composed by wise people, which are skilled in research, which have publications in research. So if you have any questions, we can now continue with questions. You can turn on your microphones and ask me something. And this lecture will also be uploaded on your drive, and you will have another possibility to listen to it. Maybe when you will listen it for a second time, you will have some new questions or some suggestions. Okay? Now, could you please turn on the microphones? And when we will have our midterms, and will they be? Thank you. I'm glad if it was informative for you. According the appointment of midterms, you know, midterms are appointed by school. My only obligation is to derive lectures, to answer your questions, and the last but not least, to send questions to exam center. So exam center is the organism who is organizing the midterms, and all technical questions should be directed to exam centers, okay? Because we have different semesters, some students which are late registration students, and they have different midterms, different dates for midterms, okay? So I cannot provide you with concrete dates.
Yes, I want to ask you a question.
Yes, tell me, ask me.
How we can do the midterms about this situation, Corona, and like this? Where?
This question also to exam center, okay?
Yes,
They
okay.
are organizing these midterms electronically,
Yes.
distancing, right, in online manner, but I don't know how, because
Yes.
other people work. We have special division which is called exam center, and other staff is working for this. So sorry, I just don't have information.
Thank you very much.
Do I believe? I don't know. Any questions regarding research? Thanks for the lecture, very informative. I'm glad if you liked it. I liked it also. You know, every lecture is discover for me. I'm thinking about something new which I have never thought earlier. So thank you. And any other questions or not? Will our second midterm be chapter 4-6? No, it's a good question. Our second midterm will be chapter 4-5, but final will be chapter 6. We never repeat material which we pass during midterms for final. Okay? Because if we repeat the same material for finals, there was no need for midterm. And if there is no need for midterm, why do we organize them? So midterm 1 is chapter 1-3, absolutely, yes. Midterm 2 is chapters 4-5, perfect, Mohammed, perfect. And finally 6. I'm very explicit, as I say. Thank you, Mohammed, for helping. Do we have opportunities for doing real researches, especially medical ones? It's a little bit philosophical question. And thank you for this question. You know, you do. Why not? Because we are part of medical school. The idea is that you have to state clearly your research hypothesis. Where do you want to work? In fundamental subjects or in clinical departments? Maybe, yes, you can additionally ask me. It depends what you want to research, what you want to investigate. Okay? You have to find person with whom you will work. For example, Department of Internal Medicine, Neurology, Psychiatry, okay, or maybe Biochemistry or Toxicology. You find concrete supervisor and you start communicating with him or her. But it's possible. The general answer is yes. Any other questions? Will we be conducting research papers throughout the semester? No, we do not have. We have only 2 midterms and final. During the semester, no research paper, but if you wish, you can additionally, but there are no credits for this. Okay, if you will have time during vacations or parallel to your studies, if you have enough time, no problem. So any other questions? we had almost 40 students today. Say thank you, Ralph. So we had almost 40, I see 36 here, or 37. Thank you for joining. I hope it was a little bit interesting for you, and I hope that we shall have possibility to continue in this distance manner, and soon to have possibility to welcome you personally